There's a certain amount of empowerment that happens when people go through a fasting process. I mean, let's face it, most people are terrified of not eating. If they think if they get on a plane in New York and they were to fly to California, they'd die over Colorado from starvation, except the pretzels, that saved their life probably. So, and it's natural because your biological imperative is get enough to eat and try not to get eaten. That's essentially what your brain's trying to get you to do. And so the idea of purposely and consciously withholding access to food is a very disturbing, counterintuitive, and challenging, kind of intervention. And when people can overcome that and not just skip a meal or skip food for a day, but for a week or 2 weeks or as much as 40 days as we do at True North Health, um, after that, they come away with a certain amount of empowerment. Now they're not as fearful of if they had to skip a meal or they might experience this sensation of hunger or they, you know, worry that, their body's not capable of adapting to a lack of food for a period of time. I think that in itself has a profound effect on people, just getting rid of the fear associated with it.
Hmm.
The other thing is that most people are driven to fasting by pain, debility, and fear of death. So what motivates people is they get so desperate that they can get out of pain or that they don't die prematurely, that they're willing to do anything, even eat well or exercise or go to bed on time or, undergo fasting. And we get highly motivated people. When you think about our operation, we admit about 1,500 people a year. We've had 25,000 people undergo fasting in the last 40 years. And most of them were heavily motivated. Now, an increasing percentage of people are coming in motivated not to overcome debilitating disease, but because they understand that as beneficial as fasting is in sick people, it's even more helpful in healthy people. The people that biologically get the most proportional benefit from fasting are actually healthy people doing briefer periods of fasting in order to prevent disease rather than wait until they get sick and then try to undo the consequence. That's one of the fundamental mistakes I believe has been made by modern medicine is everything's geared towards wait till people get sick and then try to do heroic intervention, which often doesn't work very well, in order to undo the consequences of disease. So we treat the leading causes of death, which are heart disease, cancer, and diabetes, instead of the actual causes of death. The reason people get high blood pressure and diabetes and cancer, which is smoking, drinking alcohol, including organic red wine, and eating a diet that's based on animal foods and ultra-processed refined carbohydrates. If we were to refocus our attention on dealing with the reason people got sick instead of waiting and trying to deal with them after they got sick, we'd save a lot of money and get a lot better outcomes, in my opinion.
I love your passion for all of this. Can you walk us through what's happening physically, mentally, emotionally as someone goes on a process of fasting and how that deepens in difference? There's a difference there between a 1 day, 3 day, 5, 7, 30 and beyond day water fast?
Yeah, it really starts with people's, motivation. And so, again, most of the time people are driven by a specific problem. They have too much weight and they're having trouble losing it, or they're having trouble controlling what they put in their mouth in terms of refined carbohydrates or alcohol or tobacco or something. And they've decided they want to break that cycle. And for whatever reason, they've come to believe that fasting may be a tool in helping them to achieve that. So the first thing we have to really do is determine, is this really a reasonable approach for that person? Are they a good candidate? Not everybody would be a good candidate, for example, for water-only fasting. And the way you really do that is you kind of review the medical history, do a physical exam, get some lab work done, and you can then accurately predict who would be a good candidate. In terms of fasting duration, the idea is to fast as short as possible, but long enough to resolve the problem or achieve the goal. And that's why typically in healthier people, where their goals may be able to be achieved more quickly, fasting might be a few days or a couple of weeks. Whereas a person that has a very significant health challenge may be fasting many weeks or may do multiple fasts in order to achieve their goal. Once they're decided to fast and it's determined they're a good candidate for fasting, the next thing is to remember that fasting is a really intense process and it needs to be done in an environment of rest. If people are too active, and too active means even like driving cars around or going to work, doing what would be considered relatively mild activity, that can put the body under physiological stress. If you're too active, you'll burn more glucose. The only way you can get that glucose after the first 48 hours when you've burned your glycogen reserves is through breaking down lean tissue through gluconeogenesis. And we don't really want to break down our lean tissue. We want to preserve it. And that's one of the reasons fasting is so critical. Resting is so critical in fasting, is to preserve the lean tissue. If people are more active, for example, they'll lose more weight, but it won't be more fat. It'll be lean tissue. What we want to do in fasting is maximize fat, particularly visceral fat mobilization. And what's interesting is it does that. When we did a study using a DEXA scanner to analyze body composition, a male, for example, that fasted 2 weeks would on average lose about 10% of their entire body weight, but 20% of all the fat on their body and 40% of their visceral fat. So this pro-inflammatory visceral fat is preferentially mobilized in fasting, much like tumors are. For example, if you go on a fast and lose 10% of your body weight, you don't necessarily lose 10% of your breast tumor. You may lose 20 or 40 or 50 or all of the tumor because the body has its own method of mobilizing tissues in inverse proportion to their need in the body. So now you have motivated people, they're fasting, they're resting, they're hydrating. One of the big concerns in fasting, there's a physiological dehydration that occurs that's part of the hormetic effect. That is how the body is stimulating a healing response. Dehydration is a part of that. But if that becomes too severe, your kidneys could shut down. It could become a very serious problem. So we're monitoring fluid balance. And the other thing is electrolyte balance. So potassium and sodium, these things, you have a limited capacity. You can recycle them to some extent, but we need to make sure that they don't get too low because that could interfere with your heart's ability to function or your body's ability to be able to maintain itself during fasting. So that's why monitoring during fasting is important. We monitor patients twice a day. We're using appropriately physical exam, lab testing, etc. And then perhaps the most critical part of fasting is actually refeeding after fasting. And too rapid a recovery or return to feeding after fasting can result in post-fasting edema, where you get swelling, or even refeeding syndrome, where electrolyte imbalance could result in serious problems or even death. And so we're able to completely avoid those complications by using a progressive refeeding pattern. And so it takes about half the length of a fast to properly realiment after the fast, where you start with fresh fruit and vegetable juices, and you go to raw fruit and vegetables, and then steamed vegetables, and more concentrated food within the body's capacity. A lot of the materials that are mobilized during fasting are actually eliminated as you're coming off the fast. So too rapid a return to refeeding could interfere with the ultimate long-term healing benefits that one can derive from fasting. So there's lots of ways to screw it up. You could try to fast a person that's not a good candidate. That could be a disaster. You could fast an appropriate candidate, but not let them rest and hydrate and do it properly. That could be a problem. Or you could do everything right and then really screw it up by returning too rapidly to feeding, particularly inappropriate refeeding. And then the final issue is fasting's not a cure. It's a management strategy. You can't cure obesity. You can lose the weight. You might keep it off the rest of your life. But if you go back to eating greasy, fatty, processed junk, you're going to get fat again. You can't cure hypertension. We take people with 220 over 120 capped out on meds, normalize their pressure at 100 over 60 off meds. But if you go back to the salty processed foods, it's going to come back. You're not curing it. You're managing it. And you're managing it with diet and lifestyle instead of pills and potions. Now, the good news is it works really well. Like, for example, with high blood pressure, one of the leading contributing causes of death and disability, we did a study with 174 consecutive patients. 174 people achieved normal pressure without medication. We've got a study we did recently that was 27 subjects fasted, and 26 of which were able to achieve normal pressure without any intervention. One required half-dose medication. But what was interesting is we followed those people at a year. And at a year, 76% of those people had maintained their weight loss, and the majority were still normal blood pressure without medication. And so it shows that highly motivated patients are capable of making radical diet and lifestyle changes. That's not accepted to be the fact. Most physicians would tell you people can't make diet and lifestyle changes. And the data would support them in that misassumption. Because if you look at the statistics on weight loss, for example, using any of the traditional weight loss techniques, about 95% of people will have their weight back within a year. There's only about a 5% success rate, which actually isn't even as good as heroin addiction or alcoholism. So a physician actually has a better chance of getting a heroin addict off heroin than they do of getting somebody to lose weight and keep it off. Because with drug addicts, we lie to them. Or excuse me, with drug addicts, we don't lie to them. We tell them the truth. We tell them, if you're an alcoholic, for example, you have to stop drinking completely. We don't tell them to just have beer and wine. We don't tell them it's okay to, we don't tell them to put their alcohol in a smaller cup and they won't be a drunk anymore. We say you have to completely stop because you don't handle that chemical well. But with overweight people, we lie to them and we tell them, well, just change the color of your meat from red to white and you'll be fine. Or, put your food on a smaller plate and put your fork down between each bite and you won't overeat anymore. And the fact is that doesn't work. What works is getting rid of the chemicals in the food that fool the brain into overeating. And those chemicals are salt, oil, and sugar. The problem is very hard to eat highly processed foods without salt, oil, and sugar because highly processed foods are used as carrier agents to carry the salt, oil, and sugar to your palate. We even have professionals called chefs, which are trained to deliver salt, oil, and sugar to the palate using various foodstuffs as carrier agents. If you take foods, for example, like bread, and you remove the salt, oil, the sugar, the yeast, you get a product called matzah. Matzah is punishment on Passover. Nobody's overeating on matzah. It's the salt, oil, and sugar that's being used with this carrier agent. If you take beef and boil it and then try to gnaw on it, you're not going to like it. It's being used as a carrier agent for the salt, the sauces. So we're basically kind of delusional when it comes to what we're actually doing. And we're basically poisoning ourselves with chemicals and we don't even recognize it.